Hey guys, Elena here, physical therapist with Great Lakes Pelvic Rehab and Oxbow Health and Wellness. I want to talk to you today about some strategies you can try for some lower rib pain. You might have had rib pain before, and if it is familiar to you and it's been diagnosed before by a medical professional, it would feel like a pain that wraps around the rib cage. You might feel a little bit more in the front or in the back. This pain typically changes with the breathing pattern. So either more pain on the inhale or more pain on the exhale. It definitely hurts when you cough. It might be caused from coughing. Like if you've had COVID for a while and you've just been hacking, all of that force can really jar those ribs. They sit in a really, really shallow socket for that joint. So it can be easy for them to get twisted in a torsion or just shift up or down in that joint space. And then that can feel very icky in the back as well. Keep in mind, I am not a physician, nor am I examining you in person. So if this is a new pain for you or you haven't been cleared by a medical provider, this might not be for you. However, if this pain is familiar to you, these semi-non-specific strategies can help to have a rib find its way back home, so it might feel a little bit more comfortable. These are not foolproof. They do not work for me every time, but they work a good chunk of the time. My husband is a physical therapist, so in a pinch, I can have him work on it, but most of the time I try to figure it out myself, and it helps most of the time. So I want to show you those strategies and hopefully they help. First things first, I always start with a foam roller, especially for the lower ribs. Sometimes the lower ribs feel off because there's just a little bit of a twist in one of our vertebrae because we got a muscle spasm kind of pulling us to the side. This is particularly common for folks that have hypermobile joints like hypermobile Ehlers-Danlos syndrome or hypermobility spectrum disorder. So starting with the foam roller, you're going to put it across your low back. Mine is medium density foam. It is not the crazy tire tread ones. It's not overly squishy or overly firm. It's just a nice middle of the road one. You're going to use your feet as your main driver here, provide neck support as needed, and you're just going to lean back over that foam roller and use your feet to push and pull you over that foam roll. You will most likely have some pops and cracks through here. That's normal. That's okay. Some of them might feel a little twingy, or if you get to one spot where you say, oh, yeah, that's the spot that feels icky, hang out there and try to extend over it gently and do a little bit of nice deep breathing, thinking about expanding into the lower ribs and the belly, and then exhale, sinking in a little bit heavier into that foam roll. Then you go a little bit more up and down, and do what feels good. Sometimes for me, that's enough to make it feel better. It might still feel a little sore and achy afterwards, but it overall feels better to take that deep breath or to have any sort of pressure around my rib cage, like from a bag. The other strategy is doing a funky pose on a firm surface here. Beds are usually a little bit too squishy for this one. So what that looks like is going on your stomach on the firm surface. If you need a little bit of cushioning at your pelvis, that's absolutely fine. So you're going to lay down on your stomach, arms out at a T, elbows bent is okay. Now let's say my right side is the painful side, and I know it's that right lower rib. I'm going to roll onto my stomach, bend my left knee, reach it up and across towards my right hand in a twist and extension. And I'm going to do some nice deep breathing here. Breathing in nice and deeply, and with every exhale, sinking further into the ground there. And big deep breath in. and exhale, sink down and lower. So again, whatever the painful side is, the opposite leg reaches towards the painful side hand. So if my left ribs are more painful, I'm going to put my arms out at a T and reach my right leg towards my left hand over my back. This can feel a little bit crammed and jammy when you're on the ground, but what it does is it helps to push front to back into that rib space, and it can help that rib joint find its home again. Again, this is not the most specific. It works best for the lower ribs. Middle rib cage is a little bit more difficult for that funky twisty pose, but give it a try. See if it works. If it doesn't and you know it's rib pain, please see a skilled physical therapist for an evaluation. That can help quite a bit. Give this a try. See if it helps. I hope that it does.